Hello, my name is Desiree Leaphart, and I am a graduate student at George Mason University enrolled in HAP 725 Statistical Process Improvement, taught by Dr. Alemi. In this presentation, I will present a case study of Inova Alexandria Hospital, comparing it to other regional hospitals on 5 different indicators. The data used in this study was derived from Hospital Compare, Centers for Medicare and Medicaid Services. The years included in the study were 2010 through 2018. There were limitations to the data used in this study. The data are not case mix adjusted and may not reflect changes in patient mix at different hospitals. The study also focuses on a convenient set of quality measures. Selecting other measures may have resulted in different outcomes. Lastly, the control limits are set at a 95% confidence interval, meaning that there is a 5% error rate. Inova Alexandria Hospital was compared to other Inova hospitals in Northern Virginia, including Loudoun, Fairfax, Fair Oaks, and Mount Vernon. This comparison may be helpful in understanding if all Inova hospitals in Northern Virginia provide the same quality of care. For this analysis, I am going to focus on patients experiencing a heart attack or suspecting they are experiencing a heart attack. The medical term for a heart attack is myocardial infarction. The first quality indicator presented here is median time to electrocardiogram or ECG. ECGs are important tests for suspected heart attacks and should be done within 10 minutes of being admitted to a hospital. All observations outside of the control limits are circled. Here you can see that Inova Alexandria performs below the confidence interval, meaning the median time for ECG was statistically lower than that of all Inova hospitals, indicating better performance. The median time for ECG has remained steady for Inova Alexandria. The next indicator is the 30-day readmission rate for acute myocardial infarction. In evaluating readmission rates for hospitals, the standard benchmark used by the Centers for Medicare and Medicaid Services is the 30-day readmission rate. These rates should be as low as possible. Inova Alexandria's readmission rate for heart attacks has declined throughout the time period of 7 years, falling below the control limits of all Inova hospitals in 2015 and 2016. This indicates statistically lower readmission rate and better performance. The next indicator is the 30-day mortality rate for acute myocardial infarction. Alexandria was below the control limit for 2012, which indicated better performance than all comparison hospitals, but has remained in the control limit since, indicating the same performance as competitor hospitals. Payment for heart attacks has consistently been within the control limits for Inova Alexandria Hospital. Although payments are increasing, payments are still statistically the same as comparison hospitals. Average patient satisfaction is a patient's overall satisfaction with the healthcare received at a hospital, and it's reported quarterly. Inova Alexandria Hospital consistently has lower than expected patient satisfaction ratings, and in this area is performing worse in comparison to other Inova hospitals. There has been an increase in patient satisfaction since June 2017, but still below the control limits. In summary, Inova Alexandria Hospital performs better for median time to ECG and AMI 30-day readmission rate. Performance was the same as comparison hospitals for payment for heart attacks and AMI 30-day mortality rate. Average patient satisfaction at this hospital was statistically lower than that of all comparison hospitals. Thank you for watching this presentation.